And welcome to our networking with nurses, of course, partnership with the Guam Nurses Association. And this morning we are joined by Tamara Cruz, who's a telemetry nurse at the Guam Memorial Hospital. Good morning, Tamara.
Good morning, Chris. Half a day.
Thank you for joining us. Just real quick, telemetry. Maybe if you could just explain to our viewers and our listeners what exactly a telemetry nurse does.
Okay, well, telemetry, a lot of people are like, what's telemetry? Is that telemed unit? So we're like, yes, on the third floor. So basically it's patients are connected to a portable monitor. They can also be connected to a bedside monitor. And this allows us to monitor their heart rhythm, heart rate. We can also do blood pressure, the oxygen saturation. And then all of those patients' rhythms are going to a central monitor in the nurse's station. And this basically allows us, if there's any changes in their heart rhythm, heart rate, blood pressure, we're able to respond to that quickly, like we can see it in real time.
Right. And so, again, layman's terms that you described to me before the interview, those little circle things that go all over the
so they'll
patient,
have like
right?
these wires connected to their chest, and sometimes we'll give them a little pouch where their monitor can sit in there, so that way if they need to go to the bathroom, they can still move around and we're able to still monitor their vitals and their heart rhythm.
I guess if you could, we'll just start with the first question. How is being a telemetry nurse changed with the onset of the coronavirus pandemic?
Well, definitely our unit has been converted into a exclusive COVID unit on the third floor, which is actually called Care 4. So it's a mixed unit with ICU, telemetry, progressive care, and medical patients. How has it changed? Well, definitely, before, like if there was changes in their heart rhythm or their blood pressure, we could just run into the room real quick and check on them, like, how are you doing? Now it's like we would need to put on our PPE and before we can go into the room to protect ourselves. But we're still pretty much able to do the same monitoring. We still have the central monitor. We have a technician that they're 24/7, and if there's any changes, we can still respond to that.
Let's talk about COVID and the patients who are typically on the telemetry. These are patients that we hear about that have the pre-existing comorbidities, right?
Oh, definitely. So for telemetry, it is a specialized unit. So because they're attached to the heart monitor, those are typically patients that are pretty sick. So those are patients that have stroke, hypertension, diabetes, congestive heart failure, or any irregular heart rhythms, patients with electrolyte imbalances, or even dialysis patients. Typically, they will require us to monitor their heart rhythms because they're typically on special medications that could affect their heart rate, could affect their rhythm. And then also require them to be their blood pressure or their heart rate to be monitored more frequently. But they're typically one of the sicker patients that we get that usually require all this monitoring and frequent rounding from the nurses.
Let's talk about how this pandemic has changed so much. We saw in the first wave, blessed is just the wrong word, because I believe that anytime we lose any life to this virus, it's just a big defeat for us all. But we had 5 deaths in the first wave. Obviously, the numbers have climbed to, just levels that are just so alarming and concerning and causing such grief and fear in our community, as we're now up, past 40 deaths. So being on the front line, really being there and working with patients who are very susceptible to losing their lives to this virus. Tell us what it's like to walk a day in your shoes.
Oh, well, I was able to work in the COVID unit in the first wave and the second wave currently. So I can definitely see a big difference in how sick the patients were. I'm not saying that the first wave, the patients weren't sick, they were sick. But this time around, it's totally different. It's a different ball game. Patients are a lot sicker. And there's more patients, and that's why we've had to convert certain units to strictly COVID units, because there's just more patients, and they're just so sick. And as a nurse working in the COVID unit, it's definitely not the easiest. We still have the same patient load, but on top of that, we're dealing with COVID. You know, we still have to wear our PPEs, and you know, now like we're wearing our N95 masks for our entire shift. The only time we take it off is if we're gonna eat, and even at that, it's, you know, we have to social distance while we're eating. Um, and then on top of that, it's like going into these patients' room and seeing how sick they are, and just trying to communicate to them like that we're there for them, to take care of them, and try to, and also at the same time, one of the things that we try to do is connect them with their loved ones, because honestly, that's Chris, that's one of been the hardest things for me, is not being able to have these patients, you know, have their loved ones at the bedside. And I've received many phone calls, like working in the COVID units, from patients' family members. They just want updates. How's my loved one doing? Can you tell them that we're thinking of them? You know, and so that's definitely been heartbreaking. And, you know, we try our best. Like we said, you know, so seeing all these increased numbers, I remember there was in the first 2 weeks of the second wave, it was very overwhelming because it was like nonstop admissions, and patients were being put on ventilators, and our COVID ICU at the time could only handle 4. So where did those COVID ICU patients go? They end up staying in the telemetry unit. And, you know, it's just, it was very difficult. Yeah.
What's it like to lose patients to this virus?
Oh, it's hard. It's, you know, it's not your, you know, typically when we know that a loved one is dying, we call the family ahead of time and say, hey, you know, your loved one's not doing so good. You might want to come here. You might want to be here, talk to them, hold their hand. But unfortunately, we can't do that now, you know. So in a sense, we kind of have to do that for them, you know. And I've had patients who just look you in the eyes and they're terrified. They know they're going to die, or they know that they're sick and they may not recover from this. So having losing any but losing a patient to COVID is harder. Yeah.
That toll, I mean, to be there for these patients and to be that go between them and their loved ones and their families. I know that I mean, as well as working at the hospital on the front
Yeah.
lines, and then also managing your own family's safety,
Yes.
right?
Yeah. I mean, in the first wave, I had 2 elderly family members that got COVID. And I had my family members texting me, you know, asking me for updates. And, you know, I mean, fortunately, I was working in the COVID unit, so they were able to see me and feel comforted. But, you know, now it's different. Like, you know, it's hard to comfort their family members when they're not able to physically see how their loved ones look. You know, like that's definitely one of the hardest part as a nurse, not being able to connect the families when their loved one is so sick. Yeah.
So tough. Let's talk about the risk of infection, right? I mean, we talked with
Right.
Lillian at the hospital, and we've seen dozens of frontliners there at
Oh.
GMH contract the virus. What's that like
Mhm.
for you?
Oh, it's very scary because, you know, we work with a lot of these people that have tested positive. So, of course, sometimes it's like, I feel like it's in your head, right? You're like, oh, I have a scratchy throat. I'm not feeling good. My body feels warm. So you're like, oh, does that mean I have COVID? But I mean, honestly, we're so fortunate to have a really good employee health team. So if we're feeling even just a slight sickness, or you know, we also do daily wellness checks electronically. So it's like a quick survey that the employees do to see if you have any symptoms, if you're not feeling well, and they'll typically call you right away and, hey, I think you should get tested because you're showing some signs. um, so you know, having that is definitely reassuring that, you know, they're looking out for us. um, but at the same time, it's like seeing all your coworkers test positive. It's hard because, you know, we're already short staffed, and to lose one COVID nurse or nurse
Right.
that can work in a COVID unit is a lot. Yeah. Yeah.
Let's talk about these people who say, "Oh, the flu is worse." Being on the front lines and seeing these patients come and go, these patients lose their fight with coronavirus. How does it make you feel when you hear things like that?
Oh, honestly, it's really sometimes I have to like not read comments on social media. I think I read one comment that just really stuck with me wherein, you know, it's not easy to hear that COVID patients are dying. And then you read comments where they're saying, oh, what is the nurse doing? Are they sleeping? And you're like, man, we don't even have time to drink water, pee, eat, you know, do basic things during our 12, 14-hour shifts. So when you read comments like that, it makes you feel like, you know, it's like, man, I wish you could walk in my shoes for one day to see how, walk in my coworkers' shoes and see like we're, you know, wearing all those PPEs for 12 hours. It's not easy. You're drenched in sweat, you're thirsty, you're hungry, but you know, for the most part, we just have to support each other like within our hospital community, and just know that what we're doing is what the best we can with what we have.
You know, we talked with Dr. Uggan over at GMH and Lillian as well, and they tell us these stories about how quick this virus can just turn on someone. You know, that they were telling us one where they ask a patient, "How are you doing?" and they get a thumbs up, and then 3 hours later, that patient's crashing. What's that like?
Oh, I mean, we see it so much here, you know. Like I said, it's not like before where if the patient wasn't feeling good, you can just run into the room and check on them. It's not like that, you know. It takes time. We have to wear the proper PPE to protect ourselves to go in the room. Um, and so, you know, when we round on the patients, they'll say like, "Oh yeah, I'm doing fine. I'm doing well." And then to see them change so quickly, it's heartbreaking because it's like, you know, maybe they were showing signs of improvement and they, you know, looking ready to discharge or at least move to the ISO facility. But when they change so quickly and they turn for the worse, it's heartbreaking, you know, because you feel like you've done everything for this patient, you've advocated for this patient, you've done everything that you, with the tools that you have, and they're not getting better.
As we reopen the island and we're starting to see more people out and about in this modified version of PCOR 1. And talking with Lillian, she's anticipating another spike in hospitalizations. Is that kind of what the nurses at GMH are also seeing in the near future?
Um, I mean, I hope not. I mean, you know, with the community opening up, you know, just seeing videos of people lining up at Ross is kind of scary. Um, at least for me, it's scary to see that because I feel like as you know that people are we can't get too laxed in this situation. Like we still need to practice our social distancing. You still have to be vigilant and protect yourself, do whatever you can to boost your immunity, to protect yourselves and your family, because you know this is going to be around for a long time unless people take it seriously. You know, if we see the numbers go down, people might be tempted to loosen up their preparation, but they really shouldn't.
Let's talk about some of the help you guys have had. I mean, obviously staffing at the Guam Memorial Hospital has been an issue, not just this year, but years prior. It reached a point where
Mhm.
we were saying the hospital was going to be overwhelmed, and then we got some help from DOD. We got some
Mhm.
help from the staffing solutions. What's that
Yeah.
influx of help to the hospital been like for you guys on the front line?
Oh, it's been great. Initially, we had the the doctors and nurses, respiratory therapists from FEMA, and they right away, like they got their feet wet on their first day, and they've been really, really helpful, very supportive. you know, wherever they're needed, they go there. They don't complain. And they're just so helpful, you know, and we can also learn a lot from them as well, like from their experience. A lot of them are like ICU managers, like they run ICU units in the hospital they're at. So, you know, we can learn from them and they can learn from us because, you know, our hospital does have limited resources. So they can learn how to operate with limited resources as well. And then now I think just this past week, the travel nurses started. So I've had the opportunity to train one of them. And honestly, they're just having any help at this point it's nice. You know, it's relief for us because we've been doing this since March and then on top of that, having many of our coworkers get sick, you know, honestly, I can't complain. Like if we can get all the help, like we'll welcome it. We're thankful, we're grateful, and it's really honestly good relief for the staff.
Right. And, you know, when you talk about us learning from them and them learning from us, one of the stories I heard just from a friend at the hospital is that these travel nurses, when they see the limited resources that we're
Mm-hmm.
working with at the Guam Memorial Hospital, I heard one of them was like, I don't know how you guys do it. I mean, you guys come in here every day with, I mean, the conditions, the facilities, the resources, but I mean, you're still in there. You're still fighting that fight.
Oh yes, definitely. Like I always say, like as a GMH nurse, we learn to become resourceful. And I've had coworkers who moved off island and they're working in different hospitals. And one comment they always get is like, wow, you know, like we're very well-rounded. You know, like we can do anything in any situation with what you give us.
Right. MacGyvers. Right.
Yes,
Yeah.
but safely.
Right. Of course. Of
Yes.
course. T, I want to thank you. This has been a great talk. In closing, what message do you want to give out to the people of Guam? Because it's not often that we get a frontliner on the line.
Oh yeah. So I would just, you know, my message to Guam would be to be vigilant, practice your 3 Ws, and also do what you can to boost your immunity. Take your vitamins, go exercise, go for a walk, and also find ways to manage your stress because COVID is a stressful time. So, you know, yeah. So just be vigilant, Guam.
There you go. T, thank you so much. It's been a very enlightening conversation. And, you know, I love your spirit. You're out there in the front line. A lot of people would be, you know, not as bright and happy as you are, but I know that's one thing about our GMH nurses is they've got that will to just go in there every day and to give it all they got.
Thank you so much, KUM. And I just want to say thank you to GNA, GMH, and our admin and all the frontliners right now. Just keep your head up and keep moving on.
Thank you, T. We'll see you. Estad, God bless you.
Adios.
Wash your hands.
Okay.